Hello, my name is Nancy Jacob. I'm a nurse practitioner student from United States University, and I have to do a cardiovascular exam right now. I have my volunteer here. I'm gonna get his consent, but before that, I'm gonna go ahead and sanitize my hands. Hi,
Hello.
my name is Nancy. I'm a nurse practitioner student from United States University. Do I get your consent to examine you?
Yes.
Record you and upload the video on YouTube as unlisted for my professor to see and grade?
Yes.
Thank you. Can I have your name and your birthday?
Melchior Jacob,
And your birthday?
December 8, 1967.
Okay, thank you. So first, before we do the cardio exam, I'm gonna take the patient's blood pressure on both arms in the supine position and in the sitting position. So I'm gonna be using an appropriate size cuff for the patient, which in his case has to be a medium size cuff so that I don't get any false elevated or false low readings. So in checking the blood pressures on each arm, supine and sitting, I'm gonna compare those results to make sure there's no big difference that could indicate any orthostatic hypotension. And also I'm gonna observe and ask the patient if there's any symptoms of any dizziness or any blurring of vision. And then next I am going to check the neck, check for the jugular venous pressure. So what I'm gonna do is I'm gonna check for the internal jugular vein. I'm gonna have, since I already have the patient head of the bed at 30 degrees, I'm gonna have the patient turn to the left side and I'm gonna find the highest oscillation point of the internal jugular vein. And then I am gonna put a 3x5 card horizontally into the sternal notch, and then use a ruler vertically and measure that 90-degree angle, and then that will be my jugular venous pressure. And the normal finding should be less than 3 centimeters. So I'm gonna go ahead and do that now. I'm gonna find the highest oscillation point on the patient's right internal jugular vein. Okay, so go ahead and turn your head to the left side. So by the way, I am recording this video using the selfie mode of my phone. So I'm on the patient's right side right now. So I can see the highest oscillation point to be right about here. So I'm gonna put the 3x5 card here and then find the sternal notch, which is right here. And then I'm gonna find my centimeter on my ruler, which is about here. And then the 90-degree angle, the result is 2 centimeters. So it is within the normal finding, which is below 3 centimeters. So next, I am going to check for the patient's carotids, and they are located along the sternocleidomastoid muscle on each side. So I am going to palpate the carotids one at a time. They cannot be palpated at the same time because it can block the circulation to the patient's head that can cause syncope. So I'm gonna go ahead and palpate the carotid arteries. So I'm gonna palpate the right carotid arteries right now. And they're usually found at the lower third of the neck. Okay. And then turn your head this side. Thank you. Okay. So the carotid arteries palpable, but there's no thrill, and the amplitude is 2+. So that's a normal finding. And then I am going to auscultate, get my stethoscope. I'm going to auscultate the carotid arteries using the bell and diaphragm of my stethoscope. And I'm going to auscultate also one at a time. Okay, turn this way, and turn this way a little bit. Okay, so upon auscultation of the carotid arteries on both the left and right side of the neck, I did not hear any bruit or any turbulent blood flow. So next I am going to check the patient's chest. I'm seeing that the sternum is midline, and I don't see any lumps or any nodules or any noticeable indentation. The chest wall has no visible abnormalities. There's no convex or concave. I don't see any pectus excavatum or pectus carinatum or any barrel chest. The AP diameter of the chest, the anterior posterior to transverse diameter, is 1:2. Okay, and now I'm checking for any apical impulse or any precordial pulsations which are not visible at this time. So right now I'm gonna check for the point of maximum impulse. I'm gonna palpate for that, and the PMI is located at the 5th intercostal space at the mid-clavicular line on the left side of the sternum, and it's located at the mitral area. So I'm gonna have the patient turn a little bit to the side, just a little bit. Okay, and then go ahead and relax your head. Okay, so mid-clavicular line, and it's right here. I'm trying to palpate for it, and I don't feel any thrill. Okay, and it is brisk. Okay, and go ahead and hold your breath. Just a minute. Okay. Yes, so I don't feel any thrill, and it is 2 plus, and it's brisk. Okay, so now go ahead and come back here. So now I am going to palpate the apical, the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral valves to palpate for any heaves, any lifts, or any thrills. So the aortic valve is located at the 2nd intercostal space on the right side of the sternum, and the pulmonic valve is located at the 2nd intercostal space on the left side of the sternum, and the Erb's point is located at the 3rd intercostal space on the left side of the sternum, and the tricuspid valve is located at the 4th intercostal space of the left side of the sternum, and then the mitral valve is located at the 5th intercostal space, mid-clavicular line of the left side of the chest. So I'm gonna go ahead and palpate and check for any heaves, lifts, or any thrills. Okay, so I'm gonna go ahead and feel that now. So this is the aortic, this is the pulmonic, located on the 2nd intercostal space, and this is the Erb's point, and this is the tricuspid valve, and this is the mitral valve, which I didn't feel any hips, lifts, or thrills. So now I'm going to palpate for the abdominal aorta, which is located above the umbilical area, close to the epigastrium. I'm going to palpate to see if there's any palpable thrill or any turbulent blood flow, and also see if I can measure it, and it's usually less than 3 centimeters. So I'm gonna go ahead and do that now. So I'm gonna palpate deeply below the epigastrium. Okay. Good. So I did not feel any thrills on the abdominal aorta, and the measurement is approximately less than 3 centimeters. And so now I am going to auscultate for the heart valves using the diaphragm and the bell of my stethoscope. So first I'm gonna auscultate the aortic, the pulmonic, the tricuspid, and the mitral valves using my diaphragm. And then next I am going to auscultate those 4 valves using the bell of my stethoscope. And then after that, I am going to auscultate the Erb's point using the bell and diaphragm of my stethoscope. So like I said, the aortic valve is located at the second intercostal space on the right side of the sternum, and then the pulmonic valve on the second intercostal space on the left side of the sternum, and the tricuspid valve on the fourth intercostal space, and the mitral valve on the fifth intercostal space at the midclavicular line on the left side of the sternum. And then the Erb's point at the third intercostal space on the left side of the sternum. So I'm going to go ahead and auscultate those now. First, I'm going to use the diaphragm. Aortic valve, pulmonic valve, tricuspid valve, and the mitral valve. Okay, next I'm going to use the diaphragm. Aortic valve, pulmonic valve, tricuspid valve, and the mitral valve. So upon auscultation of the aortic, pulmonic, tricuspid, and the mitral valve using the bell and diaphragm of my stethoscope, I did not hear any bruit on all areas of the valves. Okay, so now I am going to auscultate the Erb's point at the third intercostal space on the left side of the sternum using the bell and diaphragm of my stethoscope. Again, the Erb's point, I did not hear any bruit. And now I'm going to check for the physiological S2 splitting, which is located at the pulmonic valve, and it's best heard during inspiration, and it is a result of the independent closures of the pulmonic and the aortic valve. So when there is a S2 splitting, it is a normal finding because it's a physiologic finding. So I'm going to go ahead and auscultate for that now at the pulmonic valve. Okay, so S2 splitting was heard. So now I'm going to auscultate for the abdominal aorta using the bell and diaphragm of my stethoscope. And then because the aorta branches into the renal arteries on each side of the abdomen, then down the iliac arteries and the femoral arteries, I'm also going to auscultate for those using the bell and diaphragm of my stethoscope. But for the purpose of this video, I'm not gonna auscultate directly on the femoral arteries. I'm just gonna auscultate over the patient's clothing, but in the ideal setting, it should be auscultated directly to the patient's skin. So I'm gonna go ahead and do that now. So I didn't hear any bruit or turbulent blood flow in the aorta. So now I'm going to check for the renal arteries on each side, which is just slightly to the side of the umbilicus. I did not hear any bruit as well on the renal arteries. So now I'm going to check the iliac arteries that are located at the iliac crest using the bell and diaphragm of my stethoscope. Okay, go ahead and move your head here. Okay, so no breathing heard on the iliac arteries. So now I'm going to auscultate for the femoral arteries. Again, using the bell and diaphragm. And they're located at the inguinal region. And I did not hear any bruit on the femoral arteries as well. So now I am going to check for the patient's extremities, the upper and the lower extremities. So I'm checking for symmetry of the extremities, of the upper extremities. Make sure that there's no edema, there's no swelling, there's no scars or any lesions, there's no shunts or any IV lines or any catheters. I am checking for the color and the warmth, and I don't see any jaundice, no cyanosis. The same thing as the lower extremities. I don't see any edema, no swelling, no redness, no warmth. They feel warm. All of the 4 extremities feel warm. And I don't see any redness or swelling or any signs of inflammation. And the legs, I don't see any varicose veins. Okay, and then I am going to check right now for the pulses. So first I'm gonna check for the radial pulses, which are located on the wrists, where the thumbs are. So checking for okay, so the radial pulses are palpable. There's no thrill, and the amplitude is 2+. So next I'm gonna check for the brachial pulses, which are located at the medial side of the antecubital fossa. And they are palpable with no thrills, and their brisk, amplitude is 2+. Next, I am going to check for the femoral pulses, which are located on the inguinal region. And they are palpable with no thrill. The amplitude is brisk, and they're 2+. So since I've already auscultated the femoral pulse earlier when I checked the aorta, I'm not gonna do that anymore because I've already heard that there's no bruit on the femoral pulses. So next I am going to check for the popliteal pulses that are located behind the knees on the popliteal fossa. And they are palpable as well, no thrill, and they're brisk, which the amplitude is 2+. Then I'm going to check for the dorsalis pedis, which are located at the dorsum of the foot, slightly above the big toes. And they are palpable, no thrill, and the amplitude is brisk and 2+. Then next I am going to check for the posterior tibialis, which are located behind the medial malleolus. And they are palpable with no thrill, brisk, and amplitude are 2+. So that's good. He has good pulses throughout. So now I am going to check for his capillary refill on all of his fingers and toes. Okay, so his fingers are pink. I don't see any cyanosis, and capillary refills are less than 3 seconds, which is good. And then can you Bend your knees, please. Bend your knees. Okay. And then the toes as well are pink, no cyanosis. And capillary refills are also less than 3 centimeters. So next, again, I'm gonna check the fingers. I'm gonna check the fingers for any clubbing. I don't see any clubbing, and again, there's no cyanosis, which I already said earlier, and I don't see any splinter hemorrhages, and there's no tar staining. Okay, so that concludes our cardiovascular exam. Everything looks good. Everything looks normal. Do you have any questions or any concerns?
No.
Okay, thank you for your cooperation. Thank you.
Welcome.
Thank you.